Well, good afternoon. After what's been another quite wet week, it's really great to be outside in the sunshine, at least for a brief moment. And again, another busy week. Started the week with conversations around child and adolescent mental health services. So I've been really impressed with the clinical changes and the management changes that are happening in those teams, and also the attention that's been paid to the look back exercise for a number of people and families who are affected by issues in that service a little while ago. Again, I was quite lucky to spend some time at UHK last week at their 40th anniversary. Great to be able to welcome the Minister Foley, to the UHK, and of course Minister Foley is from Tralee, and just a wonderful occasion celebrating all the great work that's happened from people who've worked at the hospital for over 40 years and all the developments that have taken place, and of course the exciting things we're expecting for the future of that hospital. We've been involved in a number of networking arrangements this week, particularly around homelessness. So I attended the interagency homelessness workshop, which is particularly around discharging people from hospital who are homeless. But it was just wonderful to see that interagency working with our council colleagues, working around what is a really important problem for the health and well-being of the population here in Kerry and Cork. After that, I've spent quite a bit of time agreeing priorities for the region, for the regional teams in communications and in quality and patient safety and other teams, and just setting out what we expect, the support that those colleagues will provide to the system. Next, I was really pleased to talk to the colleagues who are involved in home support and reablement, and just talk about the magnificent work that they do with a very large number of people. I think over 7,000 people in Cork and Kerry at the moment are being supported by that team, and hundreds of thousands of hours going in to our communities to make sure that they can be supported well to live at home. I was very impressed by the quality of leadership and management there, and the fact that there were so low sickness absence rates in that team. Yesterday we held a meeting of the senior leadership team to work on how we deliver on the values that we have of care, compassion, learning and trust, how we apply those to Sláinte care, and in particular, when we live our values, how that's going to impact positively on unscheduled care. Well, over the past few days we've been working very hard on a plan for the bank holiday weekend coming up. We know that's always a busy time in the health system, and we are going into that bank holiday in a very difficult, very pressurised situation in unscheduled care. A very large number of people waiting on trolleys in our emergency departments, and we've taken some very specific action as senior leaders to get that resolved as soon as we possibly can. Lastly, I'd just like to say that this week has been Staff Health and Wellbeing Week, and just pay tribute to those teams from Staff Health and Wellbeing who've been out there supporting us to live our most healthy lives, and then just hoping that you have a very healthy next few days and that we support your well-being in the workplace. Looking forward to coming out and seeing you over the next few days.